Hi and welcome to Synapse. Today we shall be looking into the bony maternal pelvis, okay, understanding of which is very important to understand the steps of labor, what is obstructed labor, okay, cephalopelvic disproportion, and so many other entities. Okay, so let's begin. Let's talk about maternal pelvis. So we're going to use a lot of images here and try to learn. Okay, first of all, so pelvis is not like straight. If you see the anatomical position of the pelvis, okay, so it is making an angle with the horizontal, right? So this is what we've been taught in anatomy, how to hold the pelvis. We're going to take the pelvis and hold it against the wall, okay, and so that the ASIS, the anterior superior iliac spine, touch the wall, okay, so then it makes an angle. So that is how the normal pelvis is placed. Now if this is the backbone, okay, if this is a vertebra, okay, and then this is your pelvis, so this is how it is placed normally, right? So a very bad diagram, but then how it's understandable. So if the person is facing like that, okay, so okay, this is the lateral side, so this is your backbone and the pelvis is going to make an angle, so it makes an angle 55 degrees. Okay, so that is the angle of inclination of the pelvis. Okay, so we all know how to hold the pelvis, correct? Fine. Now there is something called a pelvic brim. Okay, so now let's clear this and let's have a look at this. Okay, now if you look at pelvis, okay, this view is from the top, obviously, right? So this is the pelvic brim. Okay, this is called as the pelvic brim, the red thing, right? So what does that signify? It is going to divide the pelvis into the superior part, the upper half, which is called as the false pelvis, and the lower part, which is a true pelvis. Okay, the greater pelvis or the false pelvis. Why is it called false pelvis? Because it does not take part in the process of labor. Okay, it does not take active part in labor. Okay, so why is this called true pelvis? See, because the baby, okay, the fetus has to pass through the structures below it. So above it, it is just supporting the uterus. Okay, it is not going to take active part in labor. Its only job is to support the uterus. Okay, its only job is to support the uterus. Simple. Fine. And now let's look at true pelvis. Okay, true pelvis has three parts. Okay, true pelvis has three parts. There's something called as an inlet, okay, pelvic inlet, then the mid pelvis or the cavity, and the outlet, pelvic outlet, right? Fine. So the pelvic brim forms the inlet, correct? And then mid pelvis is this cavity part, and the outlet. Okay, I'll try to show an image for this outlet. Okay, have a look at this. So this is the pelvis which is viewed from below, right? So you can see the coccyx here, the pelvic, the bones are here, okay? And this is the outlet, correct? If you're seeing it from below. So inlet is the brim, outlet is this, okay? And then the cavity, whatever lies in between will be the cavity, correct? Okay. So now we'll just go back to where we were. Okay, fine. So mid pelvis, what is the important structure in mid pelvis? Okay, so this is the brim. So if you go below, you can see these are the spines, ischial spines there. So the spines are the important structures in the mid pelvis and exterior. So basically the outlet, what we have seen is the ischial tuberosities play important role. So this is to be remembered. Okay, now let us go ahead and study about the inlet. So what are the diameters? Okay, the inlet, very important. So inlet or the outlet, we have like three diameters: AP diameter, okay, then we have the transverse diameter, the oblique diameter. Okay, so inlet is a little special in that AP diameters is of three types. Okay, I'll just mention them here. There's something called a true or the anatomical conjugate. Okay, next is the obstetric conjugate. The third one is the diagonal conjugate. Okay, so let me just highlight it with a different color. True conjugate, oblique conjugate, and obstetric conjugate and diagonal conjugate. Now, how do we understand this? Okay, so let's have a look at another picture. Just clear that. Okay, have a look at this. Fine, so this is the sagittal plane. Okay, I've taken a sagittal section here, okay, of the pelvis, and you're looking at it. So what is this? This is the pubic symphysis here, okay, and this is the vertebra, correct? Now, if you look at it, the distance, okay, that is from the upper part of the pubic symphysis to the sacral promontory. Okay, so this, the thing in the black, so that is the true conjugate, which has not been mentioned here. So if it is the black thingy, is basically the true conjugate. Okay, or the anatomical conjugate. Basically doesn't have much of practical significance. Okay, now what is this thing in red? This is the obstetric conjugate. Okay, so if I just tell you the numbers, this is around 11 centimeters. Okay, obstetric conjugate is around 10 centimeters. Diagonal conjugate is 12 centimeters. These numbers are to be remembered. Okay, we'll see what is the significance in a while. So what is the obstetric conjugate? This is when the posterior surface of the pubic symphysis to the sacral promontory. Okay, and diagonal conjugate is from the lower part of the pubic symphysis to the sacral promontory. Okay, that's pretty simple to understand. Correct. Now, what is the importance? Why is obstetric conjugate so important? Okay, so if you see, what is the effective distance that the fetal head actually gets, okay, while it has to pass through this, correct? The effective, see, this is the narrowest part. Now, this distance is less. So, as you can see here, this is just 10 centimeters. Now, any obstetric conjugate less than 10 centimeters, that pelvis will be called contracted pelvis. Will be called contracted pelvis, wherein the child, okay, the fetus can't be born by vaginal route, so it becomes a contraindication for vaginal delivery, correct? So that is why this obstetric conjugate is so important. Okay, now let's look at diagonal conjugate. So when you're doing clinical examination, right, so this is where you're going to pass your fingers, right? So this is what you're going to measure. Okay, so you go, when you do your PV examination and you go in, right, you're going to try to reach the sacral promontory. Okay, so through the basically clinical examination, which is the diameter that you can measure by clinical examination, it is diagonal conjugate. Okay, so that is around 12 centimeters. Okay, so let's have take a clinical scenario. Okay, so there's a patient. Okay, lady has come and you have done the PV examination and you have found out the diagonal conjugate. Okay, so diagonal conjugate is some value. Let's say x centimeters you've got. So if see what is important for me, the obstetric conjugate. Okay, now if I ask you what is the obstetric conjugate of this patient, you would just say x minus 2. Correct? 12 minus 2 is 10. So that's how we're going to figure out the obstetric conjugate. Okay, now we have finished the AP diameters. Let's go ahead and have a look at the transverse diameters. Okay, so now this is the AP diameters. We've seen a sagittal view. We've understood the three AP diameters. Now this is the transverse diameter. Okay, so the transverse diameter of the inlet is just the distance between the two farthest points on the iliopectineal line. So this is the iliopectineal line. So you take two farthest points and take the distance between them. So here that would be around 13 centimeters. It's 12.5 to 13 centimeters. Okay, so let's write transverse. This is all regarding the inlet. Okay, so transverse diameter is around 12.5 to 13 centimeters. Okay, fine. So Then the oblique. Oblique is, see, from the sacroiliac joint to the iliopectineal eminence, basically this. Okay, from this point. So if I draw it here, it would be this. Okay, so now this is, okay, the oblique diameter. Oblique diameter, that will be around 13 centimeters. Okay, now is this the right side or the left side? Okay, this is the right. Okay, this is basically the right oblique diameter. Fine. Why is it right? Which determines the side, okay, of the oblique diameter? It is just from which sacroiliac joints is involved. Okay, from where you're starting the measurement, which you're considering for the measurement. Okay, that will simply tell you uh, the side of the oblique diameter. Okay. Okay, cool. Fine. So we have understood the oblique diameter. Then we will go ahead and see the mid pelvis. So we have finished the inlet. We have done AP diameters, transverse diameters, and the oblique diameter. So in the mid pelvis, we have just the AP diameter and the transverse diameter. What is the AP diameter here? Okay, it is again from the lower part of the pubic symphysis to the junction of the S4 S5. Okay, so this will be around S4 S5 here. So again, you're going to take from the lower border of the pubic symphysis to this point. Okay, that will be the AP diameter. The mid pelvis, that will be around 11.5. Okay, because yeah, if the inlet, what was the diagonal conjugate? 12 centimeters. So you go a little below because it is kind of arched. This distance is going to be 11.5 centimeters. This is for the cavity, okay, or your mid pelvis. Okay, this is the AP diameter you're considering. Okay, fine. Then what is the transverse diameter of the mid pelvis? This is important. I told you that the ischial spine, see, this is the ischial spine, they come in the cavity. So this will be the transverse diameter of the cavity. So that will be all, that's also called as bispinous. Okay, bispinous diameter, that is going to be 10 centimeters. Okay, again this is also very important. Okay, bispinous diameter less than 8 centimeters is called contracted pelvis. Okay, that's very important again. Okay, fine. Next we'll go to the outlet. Okay, the outlet is, okay, we'll take a different image. This is the outlet. Okay, so again the AP diameter is this, from the pubic symphysis to the coccyx. Okay, this is the AP diameter. Now this diameter is variable. Okay, as in during the time of birth the coccyx can move backwards. Okay, there could be a little extension here. Okay, and then the AP diameter will increase. So we will use a range actually. So we will call it from 11 to 11.5 to 13 actually. 13.5. 11.5 to 13.5. Okay, so that is kind of variable, 11.5 to 13.5. Now what is the transverse diameter here? I've told you that the ischial, the tuberosities are the important points here, okay, in the outlet. So we're going to take the bituberous diameter. This is the ischial tuberosity, right? So we're going to take the bituberous diameter. Okay, this is around 11 to 11.5, right? Okay, so that's very important. Again, bituberous diameter of less than 8 centimeters is again contracted pelvis. Cool. Okay, fine then. Let's move ahead. Okay, we have understood the inlet, the cavity, and the outlet. Okay, if the diagonal conjugate is given, how to calculate the obstetric conjugate. Okay, let us just see what were the definition, like contracted pelvis. Okay, we have studied the obstruction could be at 3 levels. Okay, it could be at the level of the inlet, or it could be in the cavity, or it can be at the outlet. Inlet, that is your obstetric conjugate less than 10 centimeters. Good. Cavity, bispinous diameter less than 8 centimeters. Outlet by tuberous diameter less than 8 centimeters. Okay, all of this makes sense now. Okay, now if there is contracted pelvis, what should you do? Basically, you can't go ahead with vaginal delivery, so you should just go for cesarean section. The mode of delivery would be C-section. Okay, mode of delivery is C-section. So when should you like assess the pelvis? Okay, pelvic assessment should be done if she is a preemie, it should be done at 37 weeks. Okay, term. So 37 weeks. Okay, you should do the pelvic examination. Now, if she's a multi, matlab she's already given birth, the pelvis would have probably expanded a bit, the ligaments would have become a little lax. Okay, so if she's a multi-gravida, so you're going to do the examination at the time of labor. At the time of labor. Okay, preemie at 37 weeks and multi at the time of labor. Fine. So now let us just look into the different types of pelvis. Okay, there are various types of pelvis here that is like important to know. Okay, so depending upon the shape, okay, the AP and the transverse diameters, we have 4 different types of pelvis. Okay, this is basically Cladwell and Mahé classification. It might be important. Cladwell and Mahé classification. Okay, so now first we have the gynecoid pelvis. Okay, then we'll talk about the android pelvis. Then let's talk about anthropoid and the platyploid. Fine. So as you can see here, what is this? The inlet. Okay, it looks like it's an oval, right? The shape of the inlet, right? And if you look at the AP and the transverse diameters, okay, the transverse diameters is more than the AP diameter. Okay, so okay, instead of writing the whole thing, I'll just write it for short. Okay, okay. So transverse diameter is more than AP diameter. Fine. That means our bispinous is greater than it's around 10 or greater than 8, and bituberous is greater than 8. Okay, that might be around 11. Okay, fine. That's cool. So the delivery will happen uh, without any obstruction, without any problem. Okay. Now, what about the side walls? Okay, the side walls here will be parallel and straight. Okay, because see the spinous processes are far apart, so the cavity will not be like contracted. The cavity would be like parallel. The side wall will be parallel and straight. Parallel and straight side wall. Okay, side wall meaning they with reference to the cavity, obviously. Okay. Now let us look at the android. So android, or this is also called as a male type of pelvis. Gynecoid is a female type of pelvis. Here the inlet will be heart shaped. Because here it was oval, here it will be heart shaped. Okay. Again, here the transverse diameter is more than the AP diameter, correct? Makes sense. Now look at the side walls. Okay, side wall as in the cavity. Okay. The cavity, if you look at it, the spinous processes are jutting inwards. The bispinous diameter is less. See, look at them, they're coming closer. Now, how would the side wall be? Side wall will be like this. Okay, it is convergent because the ischial spines are prominent. So, side wall is convergent. Okay, then let's look at the anthropoid. Anthropoid is like basically gynecoid, you just put it in the other plane, like see AP more than transverse, that's all. Okay, and then it becomes this, here it was horizontally oval, here it becomes vertically oval, so it's basically gynecoid put the other way. Okay, and here also the side wall will be narrow. Okay, because the transverse diameter itself is less, so the side wall will be narrow. Fine. So now let's look at the last step, that is the platyploid. So platyploid, look at it, it's like flat. Okay, it is like exaggerated version of gynecoid simply. So your transverse diameter is way too bigger than your AP diameter. Okay, fine. Now, if you look at the side walls, it is like too wide. So the side walls, okay, the spinous process are also like kind of far apart. So it appears like as if it's diverging. Okay, the side walls are divergent. Okay, so these are the four types of pelvis. Which is the most common type? Obviously, it's the gynecoid type. More than 50% of the women, they have gynecoid type of pelvis. Okay, around 20% of them will have android, and another 20% will have anthropoid. So these are the three most common. So platypuloid is just around another 5%, 5 to 10%. That's all. Okay, so the most common type would be gynecoid. Fine, and just to mention and a bit, there is something. There are like three terms that is to be remembered. What is triradiate pelvis? This is also called as ricketic pelvis. So if the female has suffered from rickets, okay, if she's had vitamin D deficiency early on during the development of the pelvis, okay, what happens is there will be improper development. So the pelvis will be weak, okay, there's no proper mineralization. So because of the pressure and all, it tends to gets molded in that form. So basically, the promontory is jutting out like this, and then see normally the pelvis should be like this, okay. So there they'll have pelvis like that. So it is like one, two, three. It's triradiate. So basically, your cavity is obliterated. Okay, the hips. Okay, so basically the first is the acetabulum as well as your spinous process here, acetabulum, spinous process, and the hip. All of that will become so prominent. Okay, because the pelvis is so soft, it gets molded. Okay, this is called as triradiate pelvis. Again, the delivery by vaginal route is not at all possible here. Okay, next is we'll have a look at what is a Robert's pelvis. So this is a congenital anomaly wherein both the ala of the sacrum go missing. Okay, so this is the ala of the sacrum, correct? So this is the ala of the sacrum. So the ala of the sacrum is missing. So both the ala are missing. That's Robert's pelvis, and Naegeli's pelvis is just if one ala is absent. Okay, one ala absent, it is Naegeli's. Both the ala are absent, it's Robert's pelvis. Triradiate is seen in vitamin D deficiency. It is also called as ricketic pelvis. Okay, cool. So I guess we have discussed everything important that is to be told regarding the maternal pelvis. Okay, let's just have a quick recap. Okay, so we'll talk about the inlet here, we'll talk about the mid pelvis, and we'll talk about the outlet. Okay, first regarding the AP diameters. Okay, AP, quickly just go with me. Okay, so true was 11, obstetric was 10, diagonal was 12. Okay, so for the okay, we'll finish off inlet first, then we'll go to transverse we studied was around 13 to 13.5, or rather just remember one number, 13. And then coming to oblique was 12 centimeters. Fine. Now mid pelvis the AP was 11.5. Okay, how do we remember? See, as you go down, it's kind of it's a curved path, right? So the diagonal is 12, mid becomes around 11.5 centimeters. Okay, and then transverse is what is important here. Transverse will be bispinous, so that is 10 centimeters. Okay, cool. So then outlet, we told the AP is very it can vary. Okay, it is somewhere between 11.5 to 13.5 because the coccyx can move during the process of labor. And then transverse, again we have the bituberous, which is 11 centimeters. Okay, bispinous system, bituberous is 11. So this is like pretty much the gist of whatever we have discussed today. Okay, so these measurements are important. Along with this, we also studied about the different types of pelvis, okay, the Cladwell-Mahay classification, and we've also seen the Nagli's pelvis, Robert's pelvis, and triradiate pelvis. Okay. Hope you find this useful. Thank you.